Perfect. All right, it's rolling. Anyways, I'm going to make a peanut butter jelly sandwich while talking about how the COVID vaccine works. That is the purpose of this video, because you're going to hear a lot about it in the news for like the foreseeable future, because the next few weeks are going to be totally devoted to talking about the COVID vaccine. So I figured that I'd do it while making one of my favorite foods ever. Anyway, so today's a palindrome, by the way. It's January 22nd, 2021. And I believe the next 10 days are all supposed to be palindromes, so that's pretty cool. But let's get talking about the COVID vaccine. So basically there are two that are available right now. There's Pfizer and Moderna, okay? They are both gone through all the clinical trials, and they're the two that have been approved for the general population to use. So you're going to hear a lot about those two mainly. There are a bunch of other ones that are in trials right now, like upwards to 50 in phase 3, which is the last step that you have to go through. And hopefully we're going to see those available too soon. But what's super cool about these is that it's unlike any other vaccine that we've produced before. So the way that like a vaccine typically works is you take a dead fragment of the pathogen, and you take that, it's put into your body, and then of course your body produces antibodies to fight against it. But Pfizer and Moderna, these vaccines are mRNA vaccines, which this is the first time that it's ever been available to the public, these kinds of vaccines. It's a new kind of research that they've been working on for at least the past decade. And the way that these works, and this is incredible, is it takes the virus's mRNA, and if you took biology back in high school, you might remember this. It's a nucleic acid, one of those building blocks of life, very similar to DNA. And it takes the mRNA, and your body receives that vaccine, takes the mRNA, and then produces part of the coronavirus protein. It's a non-contagious variant of it. And when it gets that, it produces antibodies, which then, of course, if you were to contract coronavirus after getting the vaccine, well, your body is already prepared to fight it, right? So it's super cool. Your body literally constructs a part of the COVID and then produces antibodies to fight against the virus. We've never seen anything like that before. And it's just been a triumph of modern science and technology, because like these are actually way quicker to produce. And this is basically how we're going to make vaccines for the foreseeable future now, is through this method, just because it is so effective and we can produce it so quickly. Just to kind of like show you like how quick that was. On March 16th, Moderna was starting their phase 1 trial for the COVID vaccine. That was 66 days after we first sequenced the coronavirus. Usually that process could take years. And if you guys remember, like back at the beginning of the pandemic, that was kind of the fear that we were going to have to wait years to even like get started on producing a vaccine. But no, we were able to start this quick. It was absolutely incredible. So just the Pfizer and Moderna vaccines, which are the two mRNA vaccines that you can get right now, they're both 95% effective. The rollout has been particularly tough though, because as you would expect, like every single country in the world is trying to get their hands on it. So the supply's, been running out rather quick, even though they're like operating at max capacity to get these vaccines rolled out and available to the world. But that'll be solved with time, just as supply and demand will have it. So yeah, it is just absolutely incredible. So that's how the COVID vaccine works. It's a triumph of modern science. This is how we're going to make vaccines well into the future now. And it's just incredible. I'm incredibly grateful that like the scientific community was able to do this. And we are going to save so many lives because of it. So it's absolutely great. So anyways, I'm almost done making my sandwich here. I like a little bit more peanut butter than I like jelly, but I'm going to dedicate this sandwich that I've now made. I'm going to dedicate it to someone. I wanted to relate it back to, the medical field and like successes in science and human health. And I'm dedicating it to former President George W. Bush. Now you're probably thinking, what does George W. Bush have anything to do with public health? Well, his administration, number 43's administration, PEPFAR, which was the President Emergency Plan for AIDS Relief. It was an initiative which started in 2003, and it helped save the lives of millions of Africans by providing antiretroviral, that's how you pronounce it, antiretroviral drugs. It's still used today, and the effectiveness is shown purely through its statistics. Ever since the inception of the program in 2003, the HIV infection rate in Kenya, the most affected country in East Africa, has fallen from 14% at the time of PEPFAR beginning to 5% today. So absolutely incredible. And little fun fact on it, President Bush worked with Dr. Fauci, who you absolutely know because of him helping lead the fight against coronavirus here in our country. But at the time, he actually worked with President Bush to set up a funding mechanism to actually get these drugs to Africa. And just to leave you guys on a note here, this is what I thought was really cool. Bush gave a speech about it in 2016, the effectiveness of the program and just the effectiveness of foreign aid. Said, "I believe that spending less than 0.2% of our federal budget to save millions of lives is in the moral, the practical, and the national security interest of the United States." Very well said, President Bush. And I'm incredibly grateful for the success of PEPFAR. I mean, obviously helping save the lives of millions of people is something to be grateful for, but it also just kind of shows the positive change that the United States can make in the world on a global scale when we really put our minds to it. And I'm sure Bush is also very grateful for the successful of it too, because the rest of his foreign policy was a complete disaster. So that's the PEPFAR program, everybody. So this one is to you, George. Thank you, everybody.